Good evening, everyone, and welcome back to part two of the Goat Ownership webinar series by StockSense. I'm Dominic Enter, the Project Livestock Officer at StockSense, and I'm going to be your host tonight. Your feedback's very important to us. If you're new tonight and didn't attend last night's webinar, if you wouldn't mind filling out the pre-webinar survey, it helps us plan future events. I'll just recap last night's webinar. So it was broken up into 4 parts. We talked about traceability and tagging requirements, the do's and don'ts of goat care. I thought the 9 T's that Darren chose, describing what to look out for when purchasing a goat, was very helpful. There's some great information also on feet, teeth, and horn management, and we finished off with a Q&A session. These are our upcoming events for StockSense for August and September. Hopefully there's one near you. And moving on to tonight's schedule, we have Sandra Baxendell. She's a veterinarian and owner of Goat Vet Oz. She has a huge amount of experience with goats. She has been in Western Australia farming goats over there. She's currently based in Queensland, and she's delivered webinars on an international scale. If you have any questions tonight, please type them into the box and we will try to answer these at the end. And a reminder that this webinar will be recorded and the slides will be sent to you in an email in the coming days. So with that, I'll hand over to you, Sandra. Thank you very much.
Yes, I'll just share the screen. I can't share while you're sharing, Dominic.
All right, I've just clicked stop, so hopefully give it a couple of seconds and.
Okay. Right. So I'll just talk about what topics we're going to be covering. First is gastrointestinal worms that affect goats, how to know if your goats are affected by worms and how to treat them. Then I'll go on to talk about clostridial vaccinations and vaccine care, and also about vet-client relationships and why you need to have one as soon as possible. So let's talk about what's called the disease or parasite triangle. So a goat, if it's getting sick, is for 3 basic reasons: the environment, the disease organism, or in this case, the worm, and also the goat. So let's go through the environmental aspects. Now, goats evolved in the Middle East and they evolved in a browsing environment. And if a goat is eating with its head up, it's eating too high and it won't get any worm larvae. So goats put their evolutionary effort into metabolizing the toxins in browse plants rather than developing an age resistance to worms. Commercial dairy goats are generally in a feedlot situation, so that they don't have to be wormed because they have no grazing and therefore the parasites can't complete their life cycle. But feedlotting means that there's no green patches of grass whatsoever, and you have well-designed feeders. So either fence line feeders, as you see here on the left, or you can make your own quite easily. In this case here, there's just a hot wire that's been put across from the top of the fence over that feed trough to prevent those kids from jumping in and contaminating their feed with their feet which might have some manure on it and therefore worm larvae on it. Here's a good design for a hay rack, one that I used when we had our commercial dairy. The goats have to turn their head on the side so that they keep their head inside that hay rack, and it's also too small an opening for goats to jump into it. And that's keeping the feces away from the hay. You don't use feeders like this. If kids can get in or the goats can put their feet in, then it's going to get contaminated with worm larvae. And this is what the worm larvae look like. They're in the dew on the pasture. So one of the few things that goats have got going for them in regard to worms is that they eat from the top of the pasture down, whereas cows and sheep will get down to the bottom. Goats will browse the top as a preference. And if you look at this graph, which is looking at the distribution of worm larvae on its side, you'll see that there's a significant proportion of worm larvae actually hidden in the soil to come out when the rain comes. 50% of them approximately are below 5 centimetres. 10% would, at 10 centimetres of pasture height, there's very little worm larvae left. And at 15%, almost 15 centimetres of pasture height, almost no worm larvae are swimming up that high. The other thing you can do if you've only got a small acreage and you don't have any cattle or other animals to browse, to graze and get those pastures free of worm larvae, and you can't lock them up for long enough, you could actually offer your neighbour's horse some free grazing and let that horse graze down that pasture till it's very low, then lock it up and let that pasture get above at least 5 centimetres, preferably 10 centimetres, and then that pasture would be relatively clean and free of worm larvae. So going back to our disease triangle, let's look at the goat. You can select for resilience in goats by using the Famacha score, and I'll cover that in a minute. That only works for Barber's pole worms. You can also select for fecal worm egg counts, which is looking for resistance for all worms. Or you can buy your goats from a breeder that's proven to have good genetics for worm resistance. And here is a trial that was done by Meat and Livestock Australia, and this is the worm egg count. And these are the buck's name, and they looked at the offspring of those bucks. And you can see here a huge variation from 45 minus 30, in that worm egg count. And you obviously want an estimated breeding value that's low, so minus 30 is excellent, because you want to have low worm egg counts. But we're looking at a generational interval of 2 years for goats. But for Barber's pole worms, that generational interview is only 17 days. So the worms are going to be better at selecting for resistance than we are at selecting for resistance to worms in the goats. You can improve the resilience of goats by making sure that they're well fed, because well-fed goats can resist the effects of parasites and are less likely to die of worms. So when you're looking at nutrition, consider the energy first, then the protein, and only then vitamins and minerals. There's no magic vitamin or minerals that is going to protect from worm burdens. The other thing to consider, and this is why it's good to do worm egg counts on individual goats, is that you'll find that 20% of your herd will produce 80% of the worm eggs on pasture. So if you can identify those goats and move them on, preferably to someone that's going to be in a feedlot situation, not have them browsing, then they're less likely to contaminate your pasture. So looking at the worm egg counts of your whole herd and trying to get rid of those, or at least not breed from those that have very high worm egg counts. The other thing to consider is called the periparturient rise. You need to prepare for this. And what it is does in late pregnancy and early lactation will produce high numbers of worm eggs. And this is in response to the worms evolving to infect the next generation of kids. So some of the worms might be hibernating in the gut wall, and they'll come out, become adults, and start laying eggs. Some of the worms that are already in the gut, they'll start laying more eggs. And so around this time, your does are producing lots and lots of eggs. So you need to be aware of that and try and keep those does separate from your weaners so that they don't contaminate them. The other thing to remember is that goats that are infected with other diseases are very prone to worms. So CAE, so you can see this goat here on the left, it's got swollen knees, it's very wasted in body condition, and that's a case of CAE. This Anglo-Nubian doe here, the owner just thought it had drench-resistant worms because it had a very high worm egg count despite frequent drenching, but it actually had clinical Johne's disease. But even the stress of introducing a goat to a new home or transportation can make them more prone to worms. So the next portion of the disease triangle is the actual worms. When I first graduated, we were told to drench every goat in the herd and move them to a new pasture. But this just meant that the only worms that were moved to the new pasture were those that survived the drench. And this led to a real severe problem with promoting drench-resistant worms. So now we say that you should drench only some of the goats, and those goats should stay in the same pasture. This means that any of the drench-resistant worms are going to mate with some of the worms that aren't drench resistant, and so dilute that population of genes that allow the worm to survive drenching. We call the eggs and the larvae on the pasture and the worms in the untreated goats the refugia. And you want to try and keep this in mind because you want that refugia not to have any drench-resistant worms in it. But it is a balance. It's a balance between the lost production and your desire to prolong the effectiveness of the worm drenches. And remember, there's no new worm drenches in the pipeline, so that you should only be treating those goats that need it, so they're less resilient, or those goats that have the most worms, so they're the less resistant goats. The most dangerous worm is Homunculus contortus, or barber's pole worms. Now, only some farms in Victoria have this worms, but it's a growing number. So you need to know whether you have barber's pole worms on your property. And this can be done by larval culture or PCR test. And Homunculus contortus, or the barber's pole worms, they have this little lancet at their mouthpiece, and they actually scrape away some of the lining of the wall of the fourth stomach, and they cause a little lesion that then bleeds. The female worm then sucks up that blood, and that's what they use to produce the massive numbers of worm eggs that they can produce. This is what the fourth stomach looks like. It's one of the few worms you can actually see. You can see tapeworms, you can see barber's pole worms. But sometimes if the goats died of barber's pole worms, those worms are like the rats that leave a sinking ship. They actually detach and allow themselves to go through the gastrointestinal tract, but you can still see the pinpoint red dots where they cause those little lesions and the bleeding in the wall of the fourth stomach. So this is the life cycle. You've got the adult worms, eggs in the goats. Those eggs deposited on the pasture. Those eggs hatch, and you've got the first stage and second stage larvae. They come out of the manure pellets, and then those third stage larvae swim up the grass on the dew or the rain. And once they're up there, they may or may not go down. So you have to keep that in mind. And goats come along and eat them. So one of the things you can do, if you lock your goats up every night to protect them from dogs, you might think about leaving them locked up and feeding them some hay until the dew's gone off the grass, and that may be helpful. So the cycle of Homunculus contortus is the shortest of all the worms that we have to worry about. They can hatch in 4 to 6 days, less time if it's, more time if it's cold, less time if it's warm. So they can hatch so long as the daily maximum reaches 18 degrees and there's a lot of humidity. The larvae stay on pastures for 35 days if it's hot, and 4 to 6 months in this period of time when it's cold. So on average, it takes at least 60 days for pastures to become safe. And in winter, you're looking at 6 months. And the life cycle is from 15 to 21 days, but it's generally around 17 to 18. The other thing to remember is that Homunculus contortus, the range is spreading. So this is a graph in black and white of an old paper of where Homunculus contortus were found in Australia. And the bottom colour graph is a more recent one. And you'll see that in Victoria, the range of barber's pole worms has really dramatically increased. Clinical signs of barber's pole worms are low protein in the blood, and this leads to bottle jaw, where fluid from the blood accumulates underneath the jaw of the goat. And you can confirm that by looking at the eye mucous membranes, and you'll notice that they're very severely anemic. In this case, this poor goat is white. It's not the only reason. Bottle jaw is the only reason that you can get it, barber's pole, but you can also see bottle jaw if they've got Johne's disease or if they've got liver fluke. Now, we can classify the eye mucous membrane colour by using a Famacha scorecard. Now, goats ideally should be somewhere between a 1 and a 2, so nice and pink. And this poor goat here is a 5, which is white. Unfortunately, condition scoring and Famacha scorings go the other way. So a very fat goat is 5, and you can tell it's very fat because it's got fat deposits under its tail. And a Famacha score 5 is white. So you can remember this by saying 5 is fatal and 5 is fat. So F, F, and F. So you don't want condition scores to be too obese, and you don't want condition scores to be too skinny. So you want a nice score of around 3 for condition, but you want a 1 to 2 for Famacha score. The other word, and it may not be full scours as shown on the right-hand side here, staining of the tail and the udder there. It just may be that the pellets are clumped together, or there may be a lot of mucus in those pellets, and mucus is a sign of gastrointestinal irritation, generally caused by worms. So the other main worms of goats are your black scouse worms, which are Trichostrongylus. So in Victoria, you've mainly got the Trichostrongylus bitunus, and they only need a little bit of rainfall to get going. Then you've got the brown stomach worms, or Telodorsagia. They're in the fourth stomach again, or the abomasum. And even though you can't see the individual worms, you can see them as a moving mass if you look carefully. And then you've got Nematoderus. And these are very serious worms. The other clinical signs are rough coats and goats in very poor condition. But your most important thing is to look at worm egg counts. Now you can tell Nematoderus eggs because they're very large. So you can see this egg here on the right-hand side, and this is a strongyle egg. Now you can't tell the difference between an homunculus, a Trichostrongylus egg, or an osteotagium. They're all called just strongyle eggs because they look the same. But Nematoderus, you can tell because they're very large. So you want to diagnose before you drench or confirm before you deworm. This means that you only drench those goats that need it. And you can tell they need it either by a fecal egg count or by doing a 5-point check. And the 5-point checks are looking at the eye mucous membrane colour, looking at the body condition score, looking for signs of scouring, ideally doing a fecal egg count, looking at the coat, it should be nice and shiny, and checking the jaw or any bottle jaw. Now you need to finesse this. So does in late pregnancy and early lactation, you should treat if they've got any one of the following. You always treat for Marcher scores 4 and 5. If they've got more than 3 kids ultrasound or born, then you should consider drenching them after kidding. You looked at body condition score. If it's only 1 or 2, then you should be thinking about drenching them. Or if they're a first kidder, you might consider drenching them after kidding. If the kids or goatlings are not meeting their average daily weight gains, or they're from Archer 3, 4, and 5, then they should be drenched. Or you can look at the state drench decision guides on wormboss.com.au. So this is the WormBoss website. You go to tools and then you go to drench decision guide. And you look at 2. So you could look at both Victoria, but you can also look at Australian smallholders, because if you're keeping your goats just in a backyard, there's not much difference between a backyard in Queensland and a backyard in Victoria. So look at both of those. So this is what the drench decision guide for the Australian smallholders looks like. You agree, and then you can put in your data. So it asks you things such as your Marcher score, body condition score, fecal consistency score, and this will tell you whether that goat needs to be drenched or not. If you've got access to worm egg counting, then you can use this decision tree. It's only valid if you've got homunculus present on your farm, because remember, homunculus are putting out about 10,000 eggs per worm. So they're massive egg numbers. So for adult dry goats, if they're Marcher 1, 2, or 3, you then look at the body condition score. If it's more than 2.5, so in pretty good condition, and you don't have a fecal sample, you don't need to treat. If they're lower than a body condition score of 2.5, then you do a fecal worm egg count. If the worm egg count is lower than 750, you don't treat. If they're higher, then you treat immediately. So that's adult dry goats. If they're kids and milkers, you change that from 750 eggs per gram to 500 eggs per gram. Now, Victoria, You are allowed to use sheep over-the-counter veterinary chemicals for goats, but only under certain conditions. You must use them at the label rate, and you must not use them more frequently. So in reality, because goats always need to be given worm drenches at higher than the label dose, you're always going to need a prescription, which is called a technical advice note in Victoria. You can do drench resistance testing, but you do need large numbers of goats, of animals. So in sheep, they generally do them in bunches of, say, 60 to 80 weaners. In goats, you can use smaller numbers if you do individual worm egg counts before and after drenching. Alternatively, you can use a drench check, and this is what I recommend for smallholders. If you suspect you might have drench-resistant worms, you should also do a drench check the first time you use a new drench. And when you get to the bottom of the drench container, you should do some drench checks. And a drench check is basically looking at the worm egg count before you drench and then exactly 14 days after drenching. And you do that with the larval cultures. So the reason for the 14 days is you don't want to do it too early, because remember that worm eggs can take 24, 48 hours to get through the gut, but also sometimes the drench just makes the goats' worms a little bit sick, so they stop laying eggs. So you don't want to do it too early, but you can't leave it later than 14 days, because remember, some of those Barber's pole worms' eggs, the life cycle is starting at 15 days. So if they went out and ate some pasture with worm larvae on it, it only takes an average 17 to 18 days for those worm larvae to become mature adults and start laying eggs. And you've got to see 95% reduction in that worm egg count before you know, then you know that the worm drench was actually working. If it's less than 90%, then you know that that worm drench, the worms are getting resistance to it and it's on its way out. So the basics of drenching, you need to check that your drench gun is accurate. So if you're using a drench gun, you should put the first squirt into a syringe with the plunger taken out, your finger on the end, and just check that if you want to give 15 mils, that drench gun is delivering 15 mils. You need to make sure that you either weigh the goats or you use a heart girth chart. And there's one on my website for you to have a look at. You need to drench over the back of the tongue and ideally use a combination of anthelmintics from different classes or families. So you need to know the worms that are on your herd, and you need to know the species and whether they're resistant or not and to which drenches. And you should treat only those animals that need it based on the FAMACHA scores, the body condition score, and your drench decision guide. Now, we used to say that you should rotate your drenches every year. So when I first graduated, that's what we used to do. But that didn't work because they just developed resistance at the same rate. Then we were told to have a 5-year rotation, so change the drench family every 5 years. And then we were told to use a drench until it was no longer working and then use another drench family. But we now know, and this is the recommendation, that you should be using a combination of different drench families. And this makes sense because it means that a worm has got to get either 2 or 3 mutations to survive that drench if it's a combination drench. So makes a lot of sense. So we should be using combination drenches for goats. The only problem is there is no combination drench registered for goats. So this is where you need your private veterinarian to write you a technical advice note. So these are the 5 drench families. You've got the white drenches, you've got the clear drenches, which is levamisole, but it's also oral jet, which is a paste-like drench for goats. Then you've got your mectins. Then you've got the 2 new drenches, which are Zolvec and Startec, or monopantal. Then you've got your combination drenches, which are only registered for sheep. You do have narrow drenches. You've got organophosphates, such as ramitin, but that's a bit too dangerous to use in goats. Then you've got clocental, which only provides Barber's pole worm control. Then you've got the narrow spectrum drenches, which are your triclobendazole, which is for liver fluke, and your praziquantel, which is for tapeworms. So no matter what drench you have, you need to look after them carefully. So this is a photo here of Q drench, and you can see how it's separated into the clear portion and a white thick portion down here. If you read the label for Q drench, it says shake well before use, and you really must shake it up. I see the odd report of a death after giving Q drench, but this is the most likely cause. They haven't shaken it up enough, and so they've got an overdose of this, either the clear portion or the solid portion there. So read the label carefully. If it says shake, really shake it up. The other thing is you must keep it in the condition that the label says. Most of them say it must be below 30 degrees. Some say it must be below 28 or 25. And this basically means air-conditioned rooms in summer. And some say do not refrigerate, but they all say must be below 30. The other thing to remember is don't just rely on the names of the drenches. So say, for example, you get some new goats in and you want to make sure that you haven't brought in drench resistance, then you should, you might use Zolvex plus Startec, and you might use Q-drench. And you think, well, this is really going to kill any drench-resistant worms. But what you don't realise is that you've given abamectin 3 times, and you're probably going to overdose on the abamectin. So don't use brand names. Look at the names of the actives, which are always on the label. Unfortunately, many of the sheep drenches state do not use on an animal whose milk is used for human consumption. And a vet's prescription cannot override a do not use statement, even if the vet has access to research from overseas that will provide them with a milk withholding period. In New Zealand and then the United Kingdom, they do have default milk withholding periods. And I've written many submissions to government to try and get them to bring in a default milk withholding period. They're 35 and 45 days, so that you can use things like Q-drench on milking goats with a long default milk MRL. Don't use porons, because porons are only registered cattle. Goats don't have much subcutaneous fat underneath their hair, and they really don't work in goats. The other thing is they have a long period of time where the poron has a very tiny amount of the active still left in it. So any worm larvae that they eat towards the end of that period is going to be exposed to very low doses of that active, and hence you'll get resistance developing. So what's registered for goats? You've got Panicure or similar white drenches. We used to have Capramec, which was registered with some money from Meat and Livestock Australia, from the goat levies. That then became Verbamec Oral, which was registered for sheep and goats, but it's now no longer on sale. So It's no longer available, even though it's still registered. And you've got the oral jet goat and sheep wormer as shown there in the middle. If you look on the PubCris APVMA, Australian Pesticide and Veterinary Medicines Authority website, these are the list of drenches that are registered for goats. And you might think, well, that's a nice long list. But in reality, all the ones in black are just white drenches. So they're all the same. You've got the oral jet, which is the paste, and Verbamec oral is still registered, even though it's no longer manufactured or sold for sheep and goats. It's only sold for sheep. So an unfortunate situation for goat owners trying to control worms. There's also one permit for one Victorian farm for Cydectin oral, and they got their own permit done. But even though they're registered for goats, the dose rates are too low. If you look at goat vet textbooks, they will tell you that you need to double the dose for the white drenches. For levamisole, which is slightly more toxic, you need to have 1.5 times the dose. So that means for Q drench, it's 1.5 times the label because it has levamisole in it. And for the newer ones, Zolvex Plus and StarTech, depends on the vet's experience, that'll either be 1.5 to double the sheep dose rate. Remember that goats metabolize drugs more rapidly than do sheep. They have a very efficient liver. So this means you are going to need a vet's prescription to effectively drench goats. So in Victoria, it's called a veterinary advice note. In other states, it's called a prescription. And you will need to have this and you'll need to keep it. Now, Livestock Production Assurance will audit your use of veterinary chemicals on your farm. They choose a percentage of pigs to be audited every year. It's just a random choice of pigs. And I've been called out at very short notice to say, please come and help. I need prescriptions. The LPA auditors are coming next week. I need prescriptions for the sheep drenches that I've been using on my goats. So I've had to do a quick farm visit and inspection of the goats and write the prescriptions. This is what a veterinary advice note looks like in Victoria. It's pretty easy to fill out, and this will give the dose rate, which will always be a lot higher, and the vet then has to decide on the withholding period for both meat and, if relevant, milk. So for StarTech, the withholding period for meat is 14 days. For Zolvex, the export slaughter interval for meat is 10 weeks. So that's a long period of time. And just remember that these newer drenches can actually eat through small plastic containers. So if you're sharing a drench, just be aware that it can eat through the plastic. So when the vet looks at the withholding periods, they've got to balance off the higher dose rate they're going to prescribe. They've got to balance that against the goat's faster liver metabolism. And they also need to get it below the level of reporting. Now, science labs can detect down to parts per million of these drench actives in the meat and the milk. So it's very, very hard to get below the level of reporting. There are some resources that can be used. Of the drenches that are registered for both meat and milk, the withholding periods are there: 14 days for milk, 2 milkings for your white drench Panicure, 8 milkings for your Capramec. But the other drenches, say, don't use if they're milking and the milk's used for human consumption, and the oral jet paste also says don't use on milking goats. If you go to www.wormx.info, which is a great resource, even though it's American, so it doesn't have some of the drenches that we can have, they do give milk withholding periods for things like levamisole and ivermectin and sidectin, so that you can look at the milk withholding periods there, and the vet can keep that in mind when they're deciding on the periods. So for milking goats, there are another couple of options as well. One is the copper oxide wire particles. These only work against homuncus, but they can provide up to 21 days protection, they found in South Africa. But you can't use for more than 4 times a year, otherwise you'll get copper toxicity. The dose is 1 to 2 grams for adult goats and 0.5 to 1 gram for kids and miniatures. But there's no withholding period for both meat and milk. And research in America has shown that if you use a copper oxide wire particle bolus in combination with a white drench, it can turn the drench effectiveness from a low 60% up to 95% effective. So the combination of the two is very, very good. Now, there are copper oxide wire particle boluses registered for goats, but they're only registered to treat copper deficiency. So these are the brand names here that are listed for you. We use the tracerites because you can buy those in a small volume of only 50 capsules. But just remember, they're only registered for annual treatment. If you're going to use them more than once a year for worm control, then you're going to need a technical advice note. So they only work on Barber's pole worms. They're very good to use if you're developing drench resistance, 0.5 a capsule for weaned kids and miniatures. And ideally, you would monitor the copper levels in the liver of any butchered goats or any goats that die suddenly. And you can freeze those liver lobes until you can get them to a lab to get them analysed. And this is very important, as this graph shows. So if you look at the trace minerals and the clinical signs. So if you don't have enough copper, zinc, cobalt, any of the trace minerals, you'll have dead animals if there's nowhere near enough. You might get clinical signs of illness if there's not quite enough. And then you've got a whole range where you'll get maximum production. And then again, if you get too much of any of these trace minerals, you'll start going down, they'll get ill, and eventually they die. But copper is different. What happens is that copper is stored in the liver. It's quite happily stored, get more copper, they store it. But then the liver, it's like the camel that broke, the straw that broke the camel's back. The liver says, I cannot store any more copper at all, and it releases all the copper that it has stored. This goes into the bloodstream and it destroys the red blood cells, and the goat dies. So this is what it looks like. You'll have a very pale liver. It's no good testing this liver for copper because it's all been released. It's gone into the bloodstream. That blood is very dark. The kidneys become this typical, what's called gunmetal blue, because the kidneys are trying to filter out all these dead red blood cells, and so they're no longer red, they're this blue colour. And that's typical of copper toxicity, and the goat's suddenly just dead. So, and a lot of people think they've died of worms, where in actual fact they've died of too much copper. Unless you get postmortems, you would never know. Now, for milking goats and for small numbers of goats, you can use biowormer. Now, biowormer is not a drench. It does not kill the adult worms. It does, it kills the hatched larva in the manure. Basically, it is just a large amount of fungal spores. It's a natural fungus that's found all over the world in the soil, and it's just grown up and massive numbers of the fungal spores are grown and then processed, and then you feed those fungal spores to the goat. Goats don't absorb those fungal spores. They don't hatch out until they're in the manure, and then those fungal spores hatch out. The fungus lassoes these hatched larvae and eat them. I will make a disclaimer here that I actually sell biowormer myself, so take what I'm saying with a bit of grain of salt, but it is registered. It's been shown to kill 86% of the worm larvae in the manure of goats and also other livestock. So there's no withholding period. So very good if you've got milking goats. And it's ideal if you're feeding these animals daily anyway. It kills drench-resistant worms. So on those herds that have got drench resistance, it's really ideal. Now, it is expensive. So you can buy the liver mole with biowormer, which is sold in produce merchants, or you can buy the pure biowormer, which is sold only by vets. So if it's too expensive to use all the times I would use it is when you've got new goats being introduced and you don't want to introduce any drench-resistant worms. A barber's pole worm will last 70 to 90 days before it dies of old age. So if you can keep those animals in quarantine and feed them biowormer, then those drench-resistant worms which have survived the quarantine drench are going to get killed by the biowormer. And you should also consider for the parturient rise. There is Barbavax. It again has no withholding period, but it needs 2 priming doses, and then you've got to give a vaccine every 6 weeks during the worm period. So it is a lot more work. This was the trial. They trialled Barbavax in goats in 3 locations. You can see in Gyra, it worked very well. There was a good response to Barbavax, but in Chiswick, there was very little difference. And so they didn't proceed to registration. But your vet can give you a prescription if you've got, say, drench-resistant Barber's pole worms, then Barbavax is one of your tools in your tool. So in summary, you've got these 6 R's of worm control. You must use the right product, the right trench, on the right animals only, so those that need it, at the right time, at the right, so with a drench gun over the back of the tongue, and combine that with right pasture management. So moving on now to vaccinations. Vaccinations is like life insurance. If you wait until it's needed, it's too late. So I generally recommend Clostridial vaccines, Glandvac 3, and the dose for any size animal is 1 ml under the skin. You should vaccinate your pregnant does 4 weeks before kidding. And this is so that the colostrum will have plenty of antibodies, especially for tetanus and enterotoxemia in the colostrum to pass on to those kids. Those antibodies from the colostrum are going to last at least 6 weeks. So if you can vaccinate your pregnant does, that's really ideal. I won't show this video, it's a bit distressing, but this is a kid 22 days old with tetanus. In the interest of time, I'll skip this. This kid got tetanus because the navel cord was not dipped in iodine. And it's critical to dip the navel cords and to have a nice, clean environment for the kids to be born in, because that navel cord has 3 tubes in it. One is an artery that goes directly into the liver and into the bloodstream of the kid. Another one goes back into the vein, and another one goes straight to the bladder. So you can get tetanus through the navel cord to cause tetanus in these kids. You should vaccinate the kids. They have to be you vaccinate them depending on whether the doe was vaccinated in late pregnancy or not. If they weren't, then you should do them at 3 weeks and again at 7 weeks, because they need 2 doses 4 weeks apart. Dose is 1 ml per goat, and goats need much more frequent vaccinations than do sheep. The sheep says annual, but for goats, you need a minimum of 6 months. If you're feeding a lot of grain, then you may need to vaccinate more often. One of the brands of similar to Glanvac 3 actually says to vaccinate every 4 months. You'll notice also the pack says that you can store the pack for 30 days. So if you're vaccinating your kids, you can use the same vaccine pack. Unfortunately, Glanvac 3 comes in a large vaccine size. So you might look at trying to share with a goat club or with some other goat keeper. But just bear in mind, if you're sharing the vaccine, to make sure it's always kept cold, and also that the other person is going to use it in a hygienic manner. I only ever use sterile needles. You can buy a box of 100 sterile needles for about $7 or $8 wholesale. It's very, very cheap. I only ever put a sterile needle into the vaccine pack. I don't use an automatic vaccination gun. Had seen too much CAE to ever be able to do that. This is what erythema looks like. The goat's actually just found dead, generally. Occasionally you can find them screaming in pain, and they die shortly afterwards. Severe diarrhea, but sometimes they're just found dead. You can use Glanvac 6, which comes in a smaller pack, but be aware that there is research that was done in the UK that showed that you get poorer protection against enterotoxemia if you're using a multiple vaccine. But if you're in a liver fluke area or a blackleg area, then your vet may say that you need it, in which case you might be vaccinating every 4 months. The other thing with the 6-in-1s is that you will get a larger reaction. So you'll get more swelling and you may actually get a sterile abscess develop at that site. Now, this is for one of the reasons I vaccinate behind the shoulder, because caseous lymphadenitis or cheesy gland, the most common site for cheesy gland abscesses to occur is actually underneath the ear. Now, you'll notice that the vaccine pack recommends vaccinating sheep underneath the ear. There's very little wool there. And also, if you're selling your goats for meat, it's an area that's not going to need trimming. But I tell people not to buy goats if their herd has abscesses in their external lymph nodes, or if there's scarring tissue where abscesses were, because you don't want to introduce caseous lymphadenitis or cheesy gland into your herd. When you have your vaccines, they must be kept in a fridge that's for animal treatments only. And you'll notice here of my fridge, I've got a display here that's displaying the temperature. You can have alarmed fridges, and I also have a data logger which monitors the temperature to make sure that that vaccine is always kept at the right low temperature. There's been studies overseas showing that vaccines stored in both dairy farmer fridges and also wholesale retailer fridges has not been kept at the right temperature. Now to the last topic, which is having a relationship with your vet. You need to have a relationship with your vet now. You don't want to be ringing around at midnight trying to find a vet that will treat goats because you've got a doe with a kid stuck in it. So make sure that you have a good relationship with your vet. The vet will need to come out at least once a year It's a good time then to talk about vaccinations, talk about your worm control plan, make sure the vet knows your husbandry procedures so that they will answer the phone and come out if you've got a kidding doe that's in different. The other thing you should do is have facilities to restrain your goat. Goats will pack up in races, so you have to be aware of that. They will actually smother they'll all race down to the end of a race and they'll smother the kids at the bottom. So races have to be short for goats compared with sheep, but you don't need a race if your goats are nice and tame. You just need an area under cover where you can tie the goat up. We use special collars that quick release and a carabiner, and there's just a little metal hook there that you can hook that onto. And if you've got a solid wall or a gate, you can push the goat up against that. Now, vets can legally supply you with small amounts of drench, provided that there's a prescription or technical advice note, and they can also provide you with small amounts of vaccines. And when you look at the price of 1 litre of Q-Drench, for example, it makes a lot of sense to have a relationship with your vet so that you can have small amounts of drench, because those drenches will expire and you have to throw them out and it's a big expense. So if you've only got a few goats, a handful of goats, it makes a lot of sense to get those from your vet, and the vet can do that. Okay. Seem to be stuck. The other option you have is phone a vet. I'm on the phone a vet, so again, a disclaimer. But if you are using phone a vet, it's a way of getting veterinary advice over the phone. You must be able to provide the clinical signs and the history. And the first question the vet's going to ask is, what is the rectal temperature? So make sure you have 1 or 2 digital thermometers. I've still got the mercury thermometers because their battery never runs out if the digital thermometer no longer works. So if you put your phone up against that diagram there, it will take you to the Phone a Vet app, where you can get phone advice and also video. The video can be used to show the goat, and that will give you some advice. That advice may be to see a vet as soon as possible, but it may best be some simple advice you can handle yourself. So these are the normal ranges. So you've got a respiratory rate of 10 to 30 minutes, 30 per minute. So you just look at where the chest goes in and out. Kids are slightly higher. The rumen movement, you can see that sometimes just by looking on the left-hand abdomen, or you can put your ears up against the left-hand abdomen, and you should get at least 1 movement every 2 minutes. And the temperature, again, a rectal temperature, and the average 39.3 and plus or minus 0.5. So firstly, we'll have some questions about worms, vaccination, and the vet-client relationship. And don't forget to do the post webinar survey. Okay, so over to you.
Thanks, Sandra. There's some great details in there about worming, drenching, vaccinating relationship and with the vet, how important it is. Yeah, we do have some questions coming in. If anyone's got any questions, please type them in the box and we'll get those answered. I've got one here. Is there a specific drench for goats with Barber's poleworm?
Yep. I'm in Queensland. It's most of our farms, 80% Barber's pole, 20% Trichostrongylis. I use Q-Drench because it has a lot of, it's got 4 actives, including one that just kills Barber's pole worms. But most of the combination drenches will kill Barber's pole worms. There's no one drench that's going to be better than others for all herds, on all goats. It really depends on the drench that works on your farm. And that means that you have to do a drench check to make sure that whatever drench it is actually working. Because I've got clients who have Q-drench resistance, even though it's got the 4 actives. It's no longer working for them.
Yep, great, thank you. While we're on that with the fecal worm egg count, would you mind just explaining how people can complete that? And then the second part of that question is there a course available that can teach goat owners how to conduct their own egg count with a microscope?
Yep. So to do your own, you need a microscope with a by 10 and by 4 and by 10 objective and a by 10 eyepiece. But it must have a mobile stage. You can't do it without a mobile stage. But it doesn't need to be an expensive microscope. And if you buy one secondhand, just make sure it's clean when you look down and move the slide. It's not got any dirt in it. So if you're buying them new, it's going to be around $600. So you have to work out whether it's going to be worth it or not. The other equipment you need is an egg counting chamber. I checked up the price of these. You can get them for America for $22 America and get them posted out. You can buy them in Australia, but it said price on the application. If you're in New South Wales, you're very lucky. The local land services vets run free worm egg counting courses, but not in other states. I have a Zoom course to teach people how to do worm egg counts. So if you're a bit science orientated, you can try that. I have done courses interstate before COVID. But yes, there are courses. I think there is a trainer in New South Wales that also does courses so that they can do it. Yep. And I'm sure if you asked around, there might be others.
Terrific. And if people are wanting to send the egg counts off, is it best to do it on a Monday or a Tuesday?
Yes, so if you're posting them, the most important thing is to make sure all the air is out. So if you're using Ziploc bags, make sure the air has been removed. If you're using bottles, some labs provide bottles and want it in bottles, fill the bottles right up to the top with manure pellets. So there's very little air. Keep them chilled until if you collect them on a Sunday afternoon, keep them chilled overnight and then take them to the post office first thing. The WormBoss website, so that's www.wormboss.com.au, that has a list of certified worm egg counting providers that have done a quality assurance program.
Lovely. Thanks, Sandra. Plenty of questions coming in now, which is great. Another one on the Barber's pole. If you have a closed herd and you test for Barber's pole and the test comes out negative, should you retest periodically, or does a negative test mean you don't have Barber's pole on your property?
Depends on the time of year that you did the test. If you did the test in spring, summer, or early autumn, then I think you're pretty safe. And you should do everything you possibly can to keep Barber's pole worm off your property. What was the other question? Yeah. So yeah, I'd probably still do a worm egg.
Should you be testing periodically?
I'd do a retest at least every year, just to check that it hasn't got in by mistake.
Yep, great. And on that, if you are buying in goats, what's the best practice around quarantine?
Okay. For quarantine, you should be giving a quarantine drench. The recommendation is to use 2 of the existing family drenches plus 1 of the new drench family. But bear in mind, don't double up on the abamectin, which is found both in Zolvex Plus and StarTech. So you'd have to use another combination drench, which is not got abamectin in it. And I'd keep them isolated for that 70 to 90 days, which is the life cycle before they die of old age. And I'd feed them biowormer in between every day to make sure that any worm larvae that do survive, 86% of those killed, and then you put them out into your wormiest paddock so that they're going to just be inundated with your non-drench resistant worms to breed them.
Great answer. Thank you. If you have only one pasture safely fenced for goats, what is the best way to ensure the worm burden is kept down? This question's with someone with 2 miniature goats on just under 1 acre.
I'd be feeding them biowormer and borrowing a neighbour's horse every now and again to really eat that pasture down. Try and keep the pasture as high as possible. If you could divide it in 2, you could have the horse on one side and the goats on the other, and then swap them about and keep that pasture always nice and high. But if you feed biowormer, we're getting pretty good results in that sort of situation.
Yeah, great. And that's a good trick with the horses. A question here on worm develop. I'd like to know how worms develop resistance.
Yeah, there's a very good video on how antibiotics develop resistance, bacteria develop resistance, and you can see that because it's a time lapse on an agar, you can see where the mutation happens, and then those bacteria go into a higher level of agar gel that's got antibiotics in it, and you can see them moving into the higher levels. Very fascinating. But basically, you're just looking at natural mutations in the worm's DNA that allow them to survive or drench resistance. And interestingly, there was some research done where they actually had some frozen barber's pole worms before the introduction of the very first modern drench, dibendazole. And they got some of those worms, thawed them out, put them into sheep, and they found even in that, those worms, which had never, ever been exposed to any new drench, some of those worms survived drenching. So it's just a natural mutation. And if you provide more and more drench pressure, then the only worms that are going to be left are those with that natural mutation.
Lovely. Thank you. I've got a question here about vaccine. Can I use 7-in-1 vaccine?
It's not advisable because of that UK research that I mentioned that showed that the protection for enterotoxemia is very, very slow. It only lasts a couple of months if you're using one of these multiple vaccines. So bear that in mind. If you need to use your 6-in-1s, your 7-in-1s because you have other diseases on your property, be advised by your vet, but to get the best protection for enterotoxemia, you might have to vaccinate more frequently.
Yep, thank you. As a new goat owner, how often do goats need to be vaccinated? I think you did mention that. Was it
I did that.
Six
so
months?
The labels say either every 6 months or every 4 months, depending on the product. And if you're feeding a lot of grain, say dairy goats, then you might have to vaccinate even more frequently that. Because I have seen and had confirmed by post-mortem goats that have died of enterotoxemia even within 6 months of vaccination.
Yep, thank you. With the prurient rise, you mentioned that you might consider drenching as a matter of course if a goat is a maiden. Why, if for matcha and BCS, is that okay? Would you do this?
Probably not, because every drench you use is just one step closer to drench resistance. But keep a close eye on those maidens after kidding, and I'd be checking their FAMACHA scores at least weekly, and maybe doing some worm egg counts and drenching before you see the clinical signs.
Thank you. Got a question here on biowormer. Is there any study on the impact of biowormer on the nematode species composition? And if there is a shift in species composition between farmers
Yep.
who use it and those who don't use it?
There's no, pure scientific published articles, but other vets and myself, we're noticing that the biowormer acts on your barber's pole worms much quicker than it does the other species. So I mentioned in Queensland, we're normally 80% barber's pole, 20% Trichostrongylus. After a year or two on biowormer, it swaps. And there's one herd now that's 100% Trichostrongylus. So it kills your barber's poles first, which is not surprising when you consider the amount of worm eggs that they produce and therefore the amount of worm larvae that are getting killed. So yes, there is a change in species. I've been trying to get a university interested in studying this, but without success.
I've got another one here on the egg counts. The test results suggest deworming with greater than 200 EPG. Should we be deworming at that worm count, or should we only deworm at the much higher egg count of 750 you mentioned for non-milking goats?
Okay, it depends on whether you've got barber's pole worms on your property or not. If you don't, then you would drench with what the drench decision guide on for Victoria says, and that is about 200 to 300 from memory, because you've only got your Trichostrongylus and your Teledosargia, which produce a lot less worm eggs. So you know that could well be true that you are drenching at 200 worms, because remember that decision chart clearly said at the top that was for barber's pole worms in barber's pole worm country.
Lovely. I've got a question here. Can I access last night's seminar as I couldn't watch it then? Yes, we'll provide that link for that in the next couple of days. One here on goat condition scoring. Anything else to look, feel for with goats that have thick coats? I've got some young mini goats with thick coats at the moment, so I'm finding it hard to tell visually that they've got enough weight on them.
You have to feel. You can't body condition score by looking at them. You actually have to feel along the loins, so along the spine in the abdomen, and feel how sharp both the horizontal and the vertical spines of the vertebrae, how they feel. Are they covered with muscle? Are they covered with muscle and fat? So there's lots of videos on how to condition score. It's very similar to sheep, except for dairy goats. But the American Dairy Goat Association has an excellent video on YouTube on how to condition score dairy goats, which is a combination of the back line, which tends to be a bit spinier on dairy goats. So you have to combine that with the cover over the ribs and also the cover in the brisket area.
Lovely. I move my goats daily, but my pasture is only 5 to 10 centimeters. Is greater than 60 days repeat pasture recommended?
60 days is the average time for worm larvae to die. So, 60 days on average, but bear in mind, it's not going to be long enough in winter. Basically, if you're just relying on locking up the pastures, if the worm eggs are hatching in 4 to 7 days, and if they're going to last for 6 months, there's no way you're going to have enough pasture, fenced pastures to use rotational grazing to control your worms. You're going to have to use a species such as a horse to really eat down those pasture, eat the larvae on the pasture. The horse is a dead end. So you can use adult cattle, but I don't like to recommend that because they do share a few species of worms, and also you've got the issue of Johne's disease, introducing Johne's disease into your property if you're using cattle to control worms.
Just on that point with other animals, are there any other animals that help with that or hinder goats?
Hinder, alpacas, llamas, and sheep all have harvest pole worms, so they're not really going to. And sheep have exactly the same worms as goats, so they're going to be absolutely not much help at all.
Not very helpful.
Rotational grazing. Yep.
With biowormer and BP, I understand that we can stop using biowormer when daytime temperature is below 18 degrees in our area. But how many days in a row does it need to stay at below 18?
It's 18 for barber's pole, but it's 11 for your Trichostrongylus, and I think it's 8 for some of the other worms. So your daily maximums are different for each different worm type. So you need to know the type of worms on your farm, and you're going to have a mix, and you've got to use the daily maximum for the species of worms on your farm. So basically in Southeast Queensland, we get daily maximums of 18 and below and above most days. So we feed biowormer all year round. But if your species of worms and your daily maximums are below that, then you can stop feeding biowormer, and when it starts going up again, you feed biowormer again. Because there's no point in feeding it if the eggs aren't hatching because it's too cold, because the fungal spores only kill the larva, they don't kill the eggs.
Yep, great. Barber's pole, you mentioned it was spread by sheep as well. Are there any other animals that spread?
Your alpacas, your llamas.
Yeah.
There is some thought that the Homunculus placei of calves is the same as Homunculus contortus. So yeah, calves would be another possibility.
Lovely. A couple more vaccination questions here. If you don't know, if you're buying a new goat with an unknown vaccination history, what's the best practice to get them up to date?
Okay, while they're in quarantine, give them a vaccine the first day they arrive. And when you release them from quarantine, which is a minimum of 4 weeks, you give them their second vaccination. And then it's in line with the rest of the herd. My poor goats, when I had a commercial dairy, I used to do a lot of training courses for overseas vets and also for goat owners. And my poor goats got vaccinated all the time by these students. So you can't over-vaccinate, really.
Good to know. If Glandvac 2 is unavailable, will Ultravac 3-in-1 be suitable?
Ultravac 3-in-1. I'm not familiar with that, but I know there is a commercial one that's similar to Glandvac 3. So long as it protects against tetanus, enterotoxemia, and cheesy gland, clostridial, caseous lymphadenitis, then that's fine.
Are there breeds of goats that are more worm resistant, or is it more a genetic thing?
It's more an individual genetic thing. And you'll find that when you start doing your individual worm egg counts. I just got a text message for today, someone that was on biowormer giving me the results. All her sheep were 0 eggs, and she's got 12 goats, and the same 3 goats were high, and they're always high. So it is genetic, and you get to know which ones are very susceptible and less resilient.
Um, we did touch on this one with if you have a closed herd, should you keep vaccinating?
Yes.
Yeah.
The Clostridial bacteria is present in every goat in very tiny amounts that causes enterotoxemia. It's present globally in every goat. It's just, you've got, think about good bacteria and bad bacteria. You've got the type D, which causes your enterotoxemia, and they will suddenly multiply if, for example, they suddenly get a change in feed, either lush feed because of rain or increase in grain that's changed the rumen. So yeah, even if it's a closed herd, you should vaccinate.
Fabulous. I'm looking at using copper bolus in our dairy goat herd. What is your advice on implementation? For example, when is it best to start with young stock? And how often should it be used? And should I be looking at getting bloods done on a frequent basis to check for copper buildup?
Yeah, bloods aren't as much help as liver. Because the copper is stored in the liver, you really need to know the level in liver, which of course, unless you want to do a liver biopsy, you can't really tell. So if you're using them for worm control, I'd start straight away. Only if you know you've got Barber's pole worm, because remember, it only works on Barber's pole worm. So get an indication. So yeah, start doing some worm egg counts. Use your copper oxide wire particles. I always use it in dairy goats with a white drench. So you've got that combination of your copper oxide wire particles and your white drench. So the resistant worms have got to get a mutation to survive both. And do your drench check afterwards to make sure it's worked.
Right. One on Johne's disease here is fecal tests good enough? How should you test for Johne's?
I'm not sure, Baron might be able to jump in here. Does your labs do fecal PCR? In Queensland, they only do fecal cultures, and fecal cultures take 4 months. They're more accurate than the blood test. The blood test, you can get false positives, which, you know, really concerning to the owners. But if you do get a positive ELISA, you always must do a fecal test. But I'm not sure if you do a fecal PCR for which you can get a result in 10 days, but a fecal culture takes 4 months. Darren?
Yeah, you might want to jump in.
The PCR is not yet approved in goats. There has been research done over the last couple of years to see if we can get it validated in goats. That research is still waiting to be published.
Yeah.
So in Victoria, if you get a blood reactor for Johne's, to clear that blood reactor, it's 2 fecal cultures 3 to 6 months apart. Or if the property has had a long history of testing negative for Johne's disease, you can make an application to do what's called a serial pooled fecal culture, which is taking feces 3 times, 10 days apart, and pooling that in one test. But you have to get CVO approval to do that.
Thanks, Baron.
That's okay.
Thank you, Baron. A couple of questions here that are all similar. Are there health risks with having a shared hobby farmyard with other animals such as chickens, ducks, rabbits, calves, ponies? And can Barber's pole be brought onto the property by animals other than goats, like wild animals?
No, so kangaroos, wild pigs won't carry it. Wild goats would, if wild goats are jumping in. Now, the other one is, are there chickens? And I often get asked this, but chickens and goats, even though they both get coccidiosis, they're totally different species between chickens and goats. So your chickens won't introduce coccidia.
Yep.
They could Chickens can carry salmonella, for example, but so can rice and rats and mice, and also birds can carry salmonella. Horses, I can't think of any disease that a horse is going to transmit to goats. Sheep, certainly. Alpacas, llamas, yep, certainly, yep.
And how about wombats and kangaroos? Are there any disease?
Wombats and kangaroos, the only thing they can introduce is Q fever, which is in all the marsupials and in the dust that's circulating around. So bear that in mind. Clinical signs in goats would be abortions. And I do recommend that people get vaccinated for Q fever if they live in a rural area. And if they're helping with kidding goats, they should get vaccinated for Q fever. But you vaccinate the people, you don't vaccinate the goats.
Gotcha. You did mention chickens. Do they help in reducing worms if they're in the same paddock as the goats and scratching the ground?
Yeah, they do. Same with geese. If you can use geese as same as you'd use a horse to graze down the pasture. Chickens will scratch up the manure, which will help dry it out, which means it's less likely to hatch out into larvae. So yeah, chickens can be good, but bear in mind that chicken feed and goats do not mix, and goats are very good at breaking into chicken houses to eat up the chicken feed, and that's going to give them ruminal acidosis, which is a very high mortality rate.
Right. I've got one that's on pastures. That's probably a little bit off topic, but I think it would be good if you could give your insight. Which seeds would you recommend be the best for goat health?
Feeds.
Grass seeds.
Okay.
Pasture seeds.
Yep. So something that's got a high legume content, because they need the protein. And really, whatever pasture is going to grow up as high as possible, and have a high protein level. So you might look at something like Tagasasti, though the goats are going to ring bark it, so it's best if it's the other side of a fence, and you cut and carry it, or they can eat it through the fence. Pigeon pea has been tried in the tropical areas, again, high legume content, and it's a tall pasture. So remember, tall pasture is less likely to get worm larvae going up to the top.
Yep,
But it
lovely.
depends on what grows in your area, basically. Yep.
Well, we've pretty much nailed all the questions. There is one on the cut and carry, actually.
Yep, cut and carry is the same as feedlot. So long as you've got good, well-designed feeders for the cut and carry. And that's what they do in Southeast Asian countries. All their goats are kept in elevated goat houses, and the feed is cut and carried to them so that they don't have to worm their goats.
Yep. And I've just got one more question. I have great vets here, but most are still using older methods for worm control and vaccines. How can I talk to them about this without being on the nose?
Okay. Just recommend they contact me, and I provide vets with a free Zoom course on worms in goats so that they can upskill themselves, or get them to, every year I do a University of Sydney course for vets that goes for a month. They could do that.
Lovely. Thank you. I think that's 7:30, so that's all we have time for. If there are any questions that haven't been answered, please send us an email at StockSense, and we'll try to get those answered for you in the next couple of days. Thank you again, Sandra. It's been lovely very insightful. I've learned a lot myself. And thank you again, Baron, for last night's presentation. If you could please fill out the survey if you haven't already done so, that would be much appreciated, so we can improve these webinars and workshops in the future. Have a great evening, everyone. See you later.
Bye.